nurses, proud nurses, standing up for our patients' safety. We're concerned for our jobs, for our livelihood, but more importantly, we are concerned for the safety of our patients.
You've already heard that this health authority is planning to replace large numbers of nurses, 122 FTEs, 85 RNs and 37 LPNs across the two large sites here. For this hospital, it means 16 LPNs and 38 RNs are on the list. Well, the patients inside have increasingly high acuity, and they need people with a high level of knowledge and skill to provide them the best care possible. So cutting out licensed and regulated nurses, both RNs and LPNs, and replacing them with care aides who have minimal education is not the answer to providing safe care, and we think there are going to be huge gaps in safety, and patients will suffer. Already we've seen in Nanaimo where they've implemented this, the nurses are filing PRFs. They go home from work crying. They're frustrated. They're angry that their patients are suffering, that they're not able to meet their standards. And they've documented this over and over for this health authority. But does this health authority listen to its staff, to its educated professionals? No, it doesn't. And their mantra is, accept it or go find another job. CDMR is not about delivering care, it's about saving money. We've seen internal documents sent to managers about how to explain to the staff that they're going to have less staff to provide care without talking about how they're saving money at the same time. That's what this is about. Nurses are targeted to relieve the fiscal pressures on this health authority. And you know who's going to pay the price? The patients. That's why we're up in arms. That's why we're fighting back. We're going to continue with this struggle. We're going to engage the nurses across the health authority. We're going to demand that this employer not renege on the last collective agreement they signed with us. Not 1 year ago, this health authority and the provincial government signed a collective agreement with the nurses of this province that we would have more help at the bedside, more registered nurses, more licensed practical nurses, that we'd have replacement on our vacation, replacement for other leaves, and that we would add new nurses to the workforce. Instead, what are they doing? The exact opposite. And if this is such a good model that's been designed through all of the time motion studies and all the data they've collected, why won't they share that data with us? Why do we have to file a Freedom of Information request to get transparency on their evidence? In healthcare, we're in the business of evidence-based practice. This health authority won't produce their evidence. I don't think they've got it. I think they're perpetuating a big lie, and we're going to pay the price, and so are the patients. So we ask the public, we ask the nurses to stand together, to fight back, to press hard on the health authority, press hard on their board of directors, press hard on our provincial government to stop this. This is a concern of every member of the public here. It should be a concern for all the staff here, and it's certainly a concern for the members of the British Columbia Nurses Union. So we're not going to end this fight today. We're not going to end this fight tomorrow. We're going to end this fight when this health authority wakes up, values the nursing care that's provided here, values the knowledge and skills of the nurses who practice in this facility and across the island, and values their commitment to patient care, which they also seem to be walking away from. Thank you very much for your attendance today.